Okay, for those of you who like the less is more, let's call it choosing wisely, let's compare the spending in cancer between the United States and the European Union. And the data, you have the references there as well too. The United States has a GDP of approximately 15.6 trillion versus 8.4 trillion for the European Union. And we do spend a lot more in healthcare. We spend about 17% of our economy goes to healthcare, which is about 2.6 trillion, versus the European Union, which spends just shy of 11%. So there's a significant difference. It's about 800 billion. In oncology, we spend about 4.8% of the total health expenditure goes to the care of cancer patients versus 4.9% for the European Union. So they spend slightly more in cancer care than we do in the United States as a fraction of their GDP. However, when you look at cancer drugs, we actually spend a little bit more. So what we think may be happening is that, in fact, some of these medications that can keep patients out of the hospital, can prevent hospitalizations, can prevent surgeries, ultimately show their benefit in that the total spending in oncology is lower in the United States versus that of the European Union.